welcome. Thank you for being here. We appreciate your time and your energy. We know it's early. We know you have other things that you do normally during the week, but we also, didn't break. All of us know how important this topic is, and we all have some kind of connection. So thank you again for being here. So I am Sherry Cole. I'm the area director for the American Foundation for Suicide Prevention, the Colorado chapter, and we have an inaugural event here today. So AFSP across the country does state days, but we've never had one in Colorado. And we knew for a while that it wasn't going to be possible unless we figured out how to do some really great collaborating with other organizations, and we've done that. So we have a four-way planning organization, which is AFSP Colorado chapter, and our AFSP national office. We've got a few folks here today from Washington, D.C. and New York from AFSP. We also work very closely with the Suicide Prevention Coalition of Colorado. And for those of you that are out there, if you want to give a woohoo, go for it. Mental Health Colorado, woo-hoo. And we also had NAMI, Colorado, National Alliance on Mental Illness. So all four groups came together to make this happen. So it's been an honor and a pleasure to work with the planning committee. If I leave your name out, I'm going to apologize for that in advance because I'm kind of looking at notes. We have, oh yeah, here we go. Susan Marine, to prepare in the French, part of SPCC. And somewhere in the room, there's Mo Keller with Mental Health Colorado. We also have Margaret Elmer with NAMI. And then we also have, these folks are out in the front room, so they're not going to hear your clapping, but Heather Phipps, Mary Jo Legesse, Chelsea Dumont, who's here from Washington, D.C. today, and myself are on the planning committee, and it was just an honor and pleasure. And we have someone from Mental Health Colorado, Aubrey, here in the center of the room, who's managing our live stream and a lot of social media for us. Thank you. Oh, and I don't mean to be remiss, but we have many people across the state and maybe in other places that are watching this live stream today. So we're grateful that you could be here in person. We're also grateful for those that aren't joining us in person today. They're going to have the same information that you do, and they're going to be hearing this morning session, and they can follow up online, as well as you guys can at some point too, with some of the same asks, or all the same asks that we're going to be talking about as we get through our morning. So I also want to give a special thanks to Dave Cecil and Johnson & Johnson Healthcare Inc. for that amazing sponsorship and wonderful breakfast that you're having. So thanks to them. We really appreciate their support. And, you know, I think I've mentioned this before, but, you know, it really does take a village, and it's our collective efforts that will help move the needle in the right direction when it comes to suicide prevention and better mental health care in Colorado and beyond. So thank you for being part of that today. I'm going to share mission statements of these four organizations, and you can probably see I can talk fast. AFSP, we're about saving lives and bringing hope to those affected by suicide. AFSP is a voluntary health organization that gives those affected by suicide a nationwide community empowered by research, education, and advocacy to take action against this leading cause of death. Mental Health Colorado, a nonpartisan organization dedicated to helping Coloradans get the mental health and substance use disorder treatment they need. They engage policymakers, providers, the public, and the press to promote early intervention, expand access to affordable services, and eradicate stigma and discrimination. Mental Health Colorado believes that all Coloradans should be able to afford and access high-quality mental health treatments. SPCC, which is Suicide Prevention Coalition of Colorado. The mission of the Suicide Prevention Coalition of Colorado is to reduce suicide and its impact for all Coloradans through advocacy, collaboration, and education. NAMI's mission statement. NAMI Colorado, the mission of them is to build communities of recovery and hope by educating, supporting, and advocating for individuals affected by mental illness and their families. So the fact that this in-person registration filled up so quickly, most of our organizations sent one email, and we were full. We've had to turn away so many people and, you know, encourage them to do the Facebook Live because we just didn't have enough room. We're going to have more space next year. But the fact that that filled up so quickly, that really confirmed for us the strength in the intersection and the collaboration of these four organizations to come together to host this special event. Because I'm sure you picked up on the fact that advocacy and education and support and suicide prevention and mental health care, that thread runs through all of them. So again, we're so pleased to be hosting this today. Housekeeping. This might sound mean, but we don't have a lot of time since we're going to be taking a photo and listening to the governor. That shortened our agenda by about 15 minutes this morning. So we don't have any planned breaks for you, but we know that you're all adults, and if you need to use the restroom or step outside and make a phone call, please just help yourself. At some point, the back door you came in is going to be closed off, but the back corner that I'm pointing to your right, that door is going to be the one that we're going to be accessing for the restrooms and such. When we leave here today, we're going to have that door to your left also open so we can get out the alley and move this group as quickly as possible over to the Capitol steps. So keep that in mind. There are restrooms on 2 levels out in the hallway of this church. We do know that cell phones are important in a daily part of our lives. We just ask that you have them on vibrate or off. If you need to make a call, we ask that you step outside the room, not just to the side or the back, just to be respectful and courteous to our neighbors. So no problem if you need to leave. We expect you to be taking breaks and stepping out as you need to. We don't have Wi-Fi access for all of you because we want you paying attention. Actually, the real reason is we need the Wi-Fi bandwidth for our live stream so that we can still keep including our folks that couldn't be here with us. So if you ask about Wi-Fi access, we're going to tell you we don't know what it is. Soul support. So we do realize that folks are in different places in their journey, and talking about losses or lived experience can be difficult. This sign is also on the door out in the hallway in the far corner. We've got several staff here today from a mental health support perspective from Colorado Crisis Services, and they're happy to lend an ear or shoulder, but they're available. And if you just need some quiet time and to be out of the room, then just help yourself. We can direct you to them. Let's see. In terms of what to expect, you have packets, there's agendas in there. As I mentioned, we're going to shorten up the agenda a little bit today. We've managed that. And when you leave today, these green bags over here to your left have a bottle of water and some snacks in them. We'd like you to take 1 bag each. And if there's still food on the table, help yourself. You can also get more food. But please, when it's time to leave today, we'll remind you again, grab a bag and packets and all of your stuff and head on over to the Capitol. We are not coming back here later today. If you happen to print vignettes about your personal story, please hang on to those and have those available for your packets that you'll either be delivering or having an appointment with. I think that's probably all the big stuff. Self-care. We just really, again, appreciate you being here today. We know this can be difficult at times. We want you to remember to be kind to yourself, not only today but in the coming days. But also, too, I think there's going to be some level of excitement because this has never happened before, and from an AFSP perspective, it's the first time for us to do a 4-way state day. So again, thank you so much. Thank you to everyone, and we'll go on to our next presenter, which I'm introducing. So, Sarah Brummett is the Director of the Office of Suicide Prevention with the Colorado Department of Public Health and Environment. The office sets statewide priorities and works with state agencies and community organizations to develop and implement effective strategies. Before joining CDCAG, say that fast 5 times, she practiced family and appellate law in both Colorado Springs and the Denver metro area. Sarah received her JD from the Stern College of Law, University of Denver, and also a Master of Forensic Psychology from the Graduate School of Professional Psychology at the University of Denver. So she's a smart cookie, and we're happy to have her here. Thank you, Sarah.
Thank you, Sherry, and thank you all of you for being here so early on a bright, cold morning. I wanted to share with you just a brief overview of the data that we have access to, as well as an overview of just a few of our statewide initiatives. And before I begin, I just wanted to highlight, because this is a day at the Capitol, over about the past 6 years, there's been at least 4 bills that have passed through the Colorado legislature that have directly impacted suicide prevention here in our state that are important to be aware of and just show how much can be achieved by the work of you folks here in the room. So for those who aren't familiar, in 2012 there was House Bill 1140, and that really helped to solidify our communication channels between our office and our hospital partners around the state. In 2014 there was Senate Bill 88, which really helped 2016, there was Senate Bill 147, which really highlighted the need for systemic change in our Colorado organizations for real lasting impact. And finally, last legislative session, there was Senate Bill 272, which created a school grants program through our office to help support Colorado schools with addressing suicide prevention in our organization. Awesome. Sorry. Right. So just a quick cliff notes. Let's see if this is working. If not, that's okay. So just a quick cliff notes in case you wanted to remain focused on your breakfast burritos and coffee. Really get you started. I don't think this would be news to any of you in the room. I think it's kind of preaching to the choir, but just really highlighting that suicide is preventable. Certainly, I hope that that's something that you all can get behind and understand. Millions of Americans each year experience suicidal ideation, but millions of Americans don't die by suicide, and really understanding that this is a continuum, and really understanding that full impact across all of the different ways that suicide affects us. When we're talking about suicide prevention, we need to make sure that it's encompassing prevention efforts before people ever get to the point of crisis, intervention and treatment, and then postvention. All are equally important and absolutely necessary for full-scale comprehensive work. When we're talking about suicide, it's not a school issue, it's not an issue for the mental health system to fix. This is a community issue. It is a public health issue that is rooted in communities, and community-based suicide prevention efforts is what will get us to that next step in prevention. So for those of you who might have seen the recent CDC report really highlighting that this is not merely a mental health issue. This is so much broader. There's so many life circumstances that go into creating risk within our communities, and our strategies need to be comprehensive in their approaches as well. We need to be broader than just mental health. Mental health is an absolutely critical part of suicide prevention, but it is not the only part. So I do have some data for you all this morning. I'll keep it very brief since I know it's still early in the morning, but I'll highlight a few places where you can go to get more data to help inform your prevention efforts at the local level. And before I go into data, I do like to pause, since these numbers, it's really quick, easy to rattle them off and look at the charts and things like that. But each of these numbers represents our loved ones here in Colorado. And so really making sure that we recognize, and I think all of you in the room recognize that each of these points is a loss. So looking at it from a different perspective, the impact that a suicide loss has on our communities. Some outdated research indicated that 6 individuals were impacted by suicide. More recent research indicates that that's nowhere near close. It's closer to 135 feel the impact quite deeply of a suicide loss. From an economic perspective, we certainly know that this issue impacts our economy in sweeping ways, both in terms of healthcare costs, but also on that loss of a loved one within our community and contributing to the economy as well. As I mentioned, across the continuum, so data from the CDC kind of helps to paint the picture. For every 1 death to suicide, there's 3 attempts that result in hospitalization, 9 emergency department visits, 27 attempts that don't result in medical treatment, and over 200 individuals that experience suicidal ideation. So really thinking quite broadly of how this impacts our community. You probably can't read this because it's nice and light blue. In 2017, you can see some of the other leading causes of death here in Colorado. Suicide is the 7th leading cause of death across all ages. And when you're looking at some of these other forms of death, and then see in 2017 we lost 1,175 Coloradans to suicide, it does eclipse those other leading causes of death. When you're looking at the impact across the age span and between genders, we do see some pretty startling disparities. The orange bars up here represent male suicide deaths, and the blue are female. And so you can see that there is kind of a bell curve in the working age population, particularly for men. Men ages 25 through 64 make up 41% of our suicide deaths each year. If you're jazzed up about data and want to really dive in, we do have an interactive data dashboard that is publicly facing. It is available to you. I'm not going to go through it here. It's available on our website, coosp.org. If you scroll down, it says New Data Tool to Help Colorado Communities. This is it. You can sort the data by county, by age, by gender, by race, ethnicity, marital status, veteran status, occupation, employment status, all sorts of things to really hone in on what are those access points and how can we better target our prevention dollars. So the Office of Suicide Prevention, for those of you who aren't familiar, I know I see a lot of familiar faces in the room, and this is all old news to you. We do have a statewide office of suicide prevention. We're housed in the Public Health Department, and it is a public health issue, so that makes sense. We've had an office since 2000 through the work of advocacy getting this started. We have a number of legislatively mandated activities. I mentioned a few of those in my opening. And then we have a few other activities that we've brought on board based on best practices in other states or countries or elsewhere that have been successful. So I just want to highlight a few of those, and then I'll go more into depth on two of them. I mentioned, not yet, sorry. I can get even closer. Oh my gosh, that's very close. Very close. All right. So the Suicide Prevention Commission, I mentioned, this really solidified Colorado's space as a leader in suicide prevention, investing in the infrastructure here in Colorado. So this is a public and private partnership that's modeled on the National Action Alliance. And I can say that after the commission was formed, that was really the jumping off point for Colorado being identified as the state with the necessary infrastructure and political support and momentum to be the state to serve as a model for the rest of the nation in creating, developing, implementing, and evaluating comprehensive suicide prevention efforts. And that is ongoing. It's called the Colorado National Collaborative. Happy to chat about it more. Or if you want to talk to Jared, he's there in a very smart-looking blazer. You can chat to him more about it. I mentioned the Senate Bill 16147 that passed. That was really highlighting the need for systemic changes within our Colorado organizations, modeled on the Zero Suicide Framework that I'll go into a little bit more. We have a small community grants making program through our office. I wish that we had more money to fund our great local partners. And there's great work happening around the state through that initiative. The Gunshot Project, which I'll mention a little bit, Man Therapy is certainly something that we're proud of here in Colorado. A homegrown resource based on the data that I just shared with you, showing that disparity and how this issue impacts men of a working age and how our traditional mental health messages often don't reach that population. We currently have two federal grants that are available for suicide prevention. One is focused on youth, ages 10 through 24, and the other is focused on the Zero Suicide Initiative. Right, so when I'm talking about comprehensive suicide prevention, what I'm really talking about is all of these things happening at once. And so there's overarching strategies across all age groups, and then there's some priority populations that we've also identified based on our data. So the 5 overarching strategies, you probably also can't read, I apologize, it's a little bit light, is implementing a shared protective factor approach. That's really that upstream prevention focused across the community, elevating the overall wellness. So we know that there's protective factors that are shared across a number of negative health outcomes, not just suicide. Whether that's substance use, child maltreatment, bullying, all of these things share common root protective factors that if we focus there, we can have a bigger bang for our buck. And so that's what that shared protective factor work is about. Zero suicide in healthcare, I'll get into that. Lethal means safety is incredibly important. Safe reporting and messaging, how we talk about suicide, both as prevention professionals, but also how we portray that in the media. And then overarching all of that, because we're public health, evaluation, data collection, and analysis to really track prevention efforts. And then our priority populations, based on what the data tells us, working age adults, again, continue to carry the burden for suicide. Nearly 70% of the suicide deaths fall in that working age range. Older adults encompass the next population, particularly hard hit by the issue of suicide, and making sure that older adult-focused strategies feature prominently in our suicide prevention efforts. Transition age adults, that time period between perhaps leaving high school or another system and then moving on into the world. Youth ages 0 to 18, and then the LGBTQ community and veterans and service members as well. Thanks, Audrey, for keeping me on track. So I just wanted to mention zero suicide. For those of you who aren't familiar, it's helpful to think about zero suicide as a constellation of all of the best practices within healthcare implemented at once within a quality improvement framework. So it was created in the Henry Ford Health System, and they were trying to create a model for perfect depression care. So what would it look like if they were implementing perfect depression care? A brave nurse spoke up and said, well, if we were doing that, not a single patient of ours would die by suicide. And that's where that zero comes from. Zero is the only acceptable number to shoot for. And there's always some course correcting that goes on, but there's a paradigm shift that happens when we say zero is where we are aiming versus the traditional standard operating procedure. Like, we're going to do our best. We know that people are going to die, but we're going to try the hardest that we can. There's a difference in how work gets done after that. And it's really focused on systemic change. So there's 7 elements of zero suicide. You can learn more about it at zerosuicide.sprc.org. There's some really great information there. I won't go over it too in depth, but I do want to let you know that this is a data-driven strategy. Health systems that have implemented zero suicide have seen up to an 80% reduction in the suicide deaths for the patients in their care, which is amazing if you think about there are higher rates in our clinical populations, and it is possible. And some health systems have gotten to zero. So just a quick primer on what zero suicide is not. It's a comprehensive approach that takes the issue of suicide off the shoulders of individual providers and clinicians. This is a systemic issue. It's not a one-and-done training that an organization can just send their champions to and be done. It is a long-term commitment to patient safety and provider safety. So making sure that all staff, regardless of their role, is trained relative to their role for suicide prevention. And as I mentioned before, health systems and mental health in general is only one piece of the puzzle. We cannot just implement zero suicide and expect to see our numbers get to zero. This is one part of that comprehensive strategy. So here in Colorado, we got an early start on things. So we've held 2 zero suicide academies. Here we have trained all of our 17 community mental health centers, as well as several hospital systems, primary care. One of our school districts came. We'll be having our next Zero Suicide Academy in April. We also feature a monthly learning collaborative where we support these organizations that have been to an academy to continue that momentum. It's a pretty heavy lift for our health system partners. And then we also are implementing the follow-up project. I won't go into too much detail, but just know that this is really taking advantage of the infrastructure we have here in Colorado with the Colorado Crisis System and that hotline, and providing continuing caring outreach via the hotline to patients that are discharging from the emergency department or an inpatient setting after an attempt or mental health crisis, since we know that caring contacts are an evidence-based strategy for suicide prevention. So I'd be remiss if I talked about suicide prevention here in Colorado and we didn't talk about lethal means safety. This is a topic that should be at the forefront of suicide prevention discussions. And means do matter. And this can be a hard topic to talk about for a lot of reasons. But we know that many attempts can happen in a short time frame. And that if you have access to lethal means during that period of crisis, it can be an incredibly dangerous situation. We also know over 90% of those who have made an attempt and survived do not go on to die by suicide. So recovery is possible. But if you have access to a firearm for your attempt, you will not get that second chance. And so our strategies are looking at how do we create some temporary safety to create some time and distance between people who might be in crisis and a particularly lethal method like firearms. So this is a little outdated. I know you're 2015, but I can tell you that the data hasn't changed, unfortunately. And so when we're talking about the issue of firearm violence here in Colorado, we're talking about suicide. Our annual firearm fatalities, suicide makes up nearly 80% of those. And so our efforts around lethal means safety have focused on two avenues. One is provider training, making sure that our providers have the confidence and competence to have those conversations with the clients that they serve, but also direct partnership with the firearm community and making sure that we're using shared messages and shared values when we're talking about firearm suicide prevention. And so we have adopted here in Colorado the Gunshot Project. We started in 5 counties in the Western Slope and are now operating in about 31 counties here in the state. And again, it's just partnering along shared values. It's creating time and distance between someone who might be struggling and their firearm. We're not talking about gun control. We're not talking about a restriction on ownership. We're not asking our local partners to engage in debates. We're just talking about firearm safety, and that's already at the core of firearm ownership. So I think I might have gotten us back on schedule if I can now. We do have a table in the rotunda. We have a number of staff members from the office here today, so if you do have questions or want to learn more about how to connect with any of our resources, please do stop us, chat with us, get some information. Our role is to support you at the local level, engaging in suicide prevention efforts, so definitely check us out. All right, I think I'm handing it off now.
out of the AFSP Washington, D.C. Public Policy Office. So on behalf of our organization, I do just want to thank you all for being here for the first day of the Capitol for Suicide Prevention. I want you to enjoy yourselves today, so please take lots of pictures. Make sure you share them on social media. You can tag us, hashtag Stop Suicide. You'll see that throughout the day. You can hashtag AFSP Advocacy. And please just share your story with everybody that you'll encounter today. So thank you for being here.
Morning.
Morning.
Mike, I'm so small I get buried by a podium, so I'm on my tiptoes here. So my name is Mo Keller, and I am interested in what he's doing. Thank you. I appreciate it. My name is Mo Keller, and I am Director of Advocacy for Mental Health Colorado. And welcome to our event today, partnering with the other organizations. We're very pleased to be part of this effort. My first thing that I would like to do is introduce to you one of our legislators who is going to welcome you to the Capitol and explain about why legislation is important. And that is Representative Lois Landgraf, right here. Representative Landgraf is from Colorado Springs. She represents that area. She has been in the House of Representatives for 6 years, and she is a true champion for mental health issues. She is the prime sponsor of a Mental Health Colorado bill this year on psychiatric advance directives, which has passed the House under her leadership and is now in the Senate and should be moving on, should be doing well. Yes. As a matter of fact, the bill passed unanimously in the House of Representatives. That's a trip. Representative Landgraf is also sponsoring a bill that we're not focusing on this morning, but is really very intriguing and innovative, and that is to create a whole new licensed facility. It's probably going to be like an assisted living center, but it's basically for individuals who whose illness in mental health, substance use, or intellectual and developmental disabilities, or traumatic brain injuries, who cannot be placed anywhere because no one will take them. And so she is walking into the great waters to design a new system with the Department of Public Health and Environment, who've been wonderfully cooperative on this effort. And hopefully within a year or so, we will have this facility for this hard-to-target population. So I wanted to personally thank her for that as well. On top of that, Representative Landgraf was our Behavioral Health Caucus prime sponsor that we offer at the legislature for the legislative members last year, and so we wanted to thank her publicly for that. So my pleasure to introduce Representative Lois Landgraf.
Thank you very much. The first challenge this morning was finding you all. So if you're expecting somebody else, you might let them know that you're here. Well, in the Baptist church. Mo said she's I forgot what you said, but something about being small. So yes, she is short and petite, but she's very mighty. And her word at the Capitol goes a long way. And I was very, very happy to find out that she is supporting my upcoming bill that will be heard on Thursday. And the good news is, I've been told it's going to pass. So we can look forward to that pilot program in maybe a year, hopefully no longer. And that will help, take care of a large number of the population that has no place to go. So welcome to the Capitol, and thank you for inviting me. We do have bills over on the floor, so I will be leaving shortly. But I wanted to just let you know how important this topic is to everybody at the Capitol, House and Senate, and certainly you know that the governor has made it a priority. We have another bill that we're trying to bring out that will create wraparound services for children and actually create an entirely new division within, I'm hoping the Lieutenant Governor's saving money, whatever that department's called. That's my hope. Whether it does that or not, I'm committed to bringing that bill forward because we absolutely have to do something. And as a Republican, I think we get, sometimes we get accused of not caring about mental health, and I can assure you there's nothing further from the truth in that. I happen to represent Fort Carson, and so you can imagine, you know, you can just begin to imagine the problems that we see down there. Children committing suicide, soldiers committing suicide, and it's awful, and it's something we have to do. I've been tracking the suicide rate amongst our military for a few years, and you know, it's not going away. It's not getting better, and it's something we absolutely have to start looking at. I had a great bill, I thought this year, to create what was called the green alert, which would be like an amber alert, but it would be for soldiers who go missing. And the United Veterans Committee decided it wasn't a good bill because it brought too much attention on soldiers and mental health, and it could hurt their ability to get a job. So, as you can see, legislation is always a balancing act. We can bring forward legislation that's actually harmful, and that's not the goal. The goal is to do the right thing, and you know, we try. But the way to get that done, just like this bill I have on Thursday, is to let us know. I found out about this need and the possibility of running a pilot program from some people at a meeting who started talking to me. One thing led to another, and now we have this great piece of legislation that, when it passes and when it's implemented, is going to open beds for people who currently have no place to go. And that's, you know, we need to be thinking about that. But you're the ones who know that. You're the experts. You need to let us know. And you can talk to your own legislator. You can talk to the legislator that's interested in that topic. You can talk to Mo, and she'll find somebody. So please, don't keep your ideas to yourself, because you're the ones. It really needs to come from you. Wouldn't you say?
Yes, absolutely.
So Mo agrees. And I've got to tell you, it's wonderful working with her. And you probably know that she's a former senator.
Yeah.
So Senator Mo is great, and she can always carry her ideas forward if that's the easiest way to go. But please, let us know, because we don't know what we don't know. I mean, that saying is maybe trite, but it's absolutely true. So thank you for being here. I'm going to go vote.
Thank you, Representative Landgraf. We really appreciate you taking the time this morning to be here. She's actually going to be a little late to get onto the floor, so she had to get excused to be here. It's just like school, you know. You have to get excused to kindergarten, just like kindergarten. Thank you very much. We also invited Senator Todd, who I understand is on her way. I'm going to go ahead, because of time, to do this portion of the agenda. When I see her, I'll break for a little bit so she can say a little to you as well. So my segment of this morning is how a bill becomes a law. Some of you may already know some of this information. How many of you have actually gone through the process of following the bill through the whole entire legislative process? 4, 5, 6, 7, 8, maybe? Okay. So you know when the term sausage making is referred, it's true, it is sausage making. There's a lot of give and take and a lot of going through. So I'm going to go ahead with our grassroots training. And in our legislature, anyone know how many members we have in our legislature in Colorado? You don't count Senator Newell. It's not fair. 100 is right, yes. We have 65 members of the House and 35 members of the Senate. How long is a legislative session?
4 months.
It's not high, it's not low. I'm sorry. Okay. Say it again. I was distracted by this machine here. 5 months. 5 months? That actually is about right. It's 120 days that the legislative session is in operation. That's because it is in our Constitution, so it is 120 days. That is inclusive of weekends. It's rare for the legislature to ever work on a weekend. But they do work till midnight, that's not rare, in order to get work done. So we work through January through May. So how does the bill get introduced? Well, Representative Landgraf was good about talking about the prior. So much of the legislation that I carried, Senator Newell carried, Representative Landgraf carries, comes from you, comes from citizens. You know, I say this all the time. Nobody believes me, but I say it all the time. People underestimate the power that you have. You know, you remember in a democracy, or a democratic republic, specifically, but that we're the boss. You know, they work for us. We don't work for them. They work for us. So the elected official, when we go to an elected official and say, this is a problem, that's a problem, this happened to me, we shouldn't be doing that, any number of things like that, most legislators pay attention, and that's where they get their ideas for legislation that they bring in. And they want your information, they want your knowledge and expertise and your personal experiences because they don't have it. But they need you to relay that. So, you know, don't be shy. Talk to your legislator at the state level on how to change policy. That's what we are all about, what our 4 organizations are all about. So we go to a legislator, we say we have an idea, the legislator works with us, they come up with the general outline, and then it's introduced in one of the 2 bodies. If it's a representative, like Representative Landgraf, it gets introduced into the House. If it's a senator, like Senator Todd, it gets introduced into the Senate. And so, first reading. So first reading is simply, it's read across the desk and it's given a number. So Representative Landgraf's bill is House Bill 1160, that just got read across the desk, that's all, the first reading. And it's assigned to committee. The committee is your chance to testify in front of the legislature, or I'm sorry, that particular group of legislators who are on that committee. Now, if you're shy about that, some people are a little uncomfortable, especially when mental health or substance abuse affected ourselves or our family members, and it's very difficult to talk about it. It's emotionally draining to talk about. You can testify in front of the committee, or you can write your story. You can set up your story, you can write it out, and you can give it to one of the members of the legislature or to the staff member, and they will distribute that to all the members of that committee. And what I always did, and most legislators do, is if I get written testimony or a written story or whatever, I keep it with that bill. So when I go back down to the House floor, to the Senate floor, we have file cabinets, and file them numerically. When I pull that out, because it's going to come on debate for the floor, I open it up and I have your story. So that's another great way in which to get your information out to a legislator, where you don't have the kind of stress of testifying in public about your particular situation or your family's situation.
Does it get entered into the record there, Mom?
It gets in, yes, that's a good question. Her question was, does our story as such get introduced into the record? It does on the committee. It'll be reflected in committee minutes, not on the floor because it's not going to be read on the floor.
Right.
But it will be in the committee. Yes, sir?
You can also testify by remote.
In certain circumstances, yes. So what has happened over the last, I think, 2 years, it hasn't been very long, the legislature has invested in technology that will allow someone on the western slope or in the southern tier or quite a distance away to be able to testify to a committee about their story. And that needs to be arranged ahead of time. You would have to call your legislator and find out how to get that technology set up because it's not routine. But we have had a number of individuals around the state who could not come this distance to Denver. So that's a good point to make as well. That technology is available. Also, since we're talking about technology, you can listen in on your computer at home. So you may have handed out your information. Now you're at home on the couch. You can go on your computer. You can go to Colorado Legislature, go to committees, and then all the committees will show up. Hit the committee you want to listen to in real time. And then that comes up. Then you can listen to the entire committee hearing. That service is also available for the Senate floor and for the House floor, but it also includes video on the House and Senate floor. Committees don't have video, but they do have audio. The other thing is that this is all archived. This is the really wonderful thing about the technology that we have in the state now, is that if you missed it and you went, oh darn, it was last week, I forgot about it, go back to last week. You can do that on all these are archives, so you can do that on the computer as well. When your committee comes up, we go down to that date, click on that date, and you can hear the archived committees. It's very good. Okay. Senator Todd is not going to be able to join us. Sorry about that. That's the committee work. Sometimes in committee they do ask questions, and by the way, we've had this happen in some very stressful bills. Just last week we had one of our volunteers, she wanted to testify, she had lost her brother to suicide. She wanted to testify, but she wasn't prepared to take questions because this was still very, very delicate for her, very raw, only been a couple months ago. What she did in her testimony, and I give her a great deal of credit for actually coming to the table and testifying. She read her statement, and then at the end she said, and please, I cannot answer questions about this. Do not ask me questions. That's okay too. You can do that too. The legislators will be respectful on these kinds of emotional issues. The legislators will be respectful of the issues. So let's say it passes committee. Then it goes to appropriations if it has money in it. So if there's any money that is attached to a bill, because we have a balanced budget in our state, we're not like the federal government that can keep running a deficit. We have to, I think all the states actually have a balanced budget. So we get X revenues coming in, we cannot expend more than that X revenues. So we are, in our efforts, we're fighting for the same dollars that everybody else is fighting for. Agriculture and water and transportation and public education, all worthy things to fund. But we have to make our case that ours is so pressing that and hopefully we will be doing this across the street as we talk about one of our asks a little bit later. So if there's any money on the bill, it's going to cost $100,000. It gets sent to the Appropriations Committee. And the Appropriations Committee will look at the finance portion. Their role is not really to look at the merits, although to be honest with you, they do. But generally speaking, they're to look at the financial piece. Can we afford this? If so, how much money do we have that is extra from all of our obligations, and will this be make the list in terms of the high priorities, the things that we want to do? So they do all that piece. I might mention that in the committee, by the way, the committee has the obligation to listen to everything, to take the witnesses. They can make amendments. They can change the bill. They can pass the bill without amendments. So they can also vote down the bill. They can kill the bill. And this does happen in committees. So they can pass the bill, and if it has no money on it, it goes directly to the House floor for debate. If it has money on it, it goes to appropriations. If they've amended it, they can do that as well, and then it's a little bit different bill than when it was introduced. Not very many bills go through the process without some kind of amendment. There are a few, but generally speaking, not too many. So after appropriations, or after it's sent from committee to the floor, now the fun begins. So here's the second reading. By the way, we have something in Colorado called the Sunshine Law. That means that whenever the House or the Senate is in session, the Capitol building must be open for the public to be able to come and listen, sit in the gallery, reach a legislator, pull them off the floor, mention something about what you're interested in. So if it's midnight, the Capitol building is open. If it's a Saturday or Sunday, the Capitol building is open if either of those bodies are meeting. So the second reading is where all the 65 members of the House now have a chance to debate the bill that was in that committee. And I say the fun begins because I always love debate. So yeah. And that's what goes on when you're down on the House floor. Any legislator can introduce an amendment. Any legislator can come up and take something out of the bill, try to cut something out of the bill, and then it's the obligation of the sponsor to defend the bill. That's part of that sausage making we talked about. So then, if it passes second reading, usually by voice vote, everybody just yells aye or nay, it goes to third reading, and that's final passage. That's formal. This is the recorded vote. So this is where, when a bill passes, on third reading, you may in the House, when you're over at the Capitol, you will see this. In the House, because there's 65 members, there has to be a lot more decorum to keep everybody in rules and in some civility. So they have on either side of the walls of the House a very large electronic board that has all the names of the legislators, and then a red, a green, and a yellow light next to each name. And on the desk, then the legislators push the button that they want to do the final third reading vote, which is their recorded vote, which they will be recognized for. So you can guess, red means? No, they're not going to vote for the bill, they're voting against it. Green means? Yeah, you're right. Go ahead. Yeah, they're voting for it. Yellow? Anyone know?
Indecisive.
Say it again?
Indecisive.
Indecisive? No. We're not allowed to get that luxury, if you will. We cannot abstain. You know, as a legislator, you worked hard to get there, and it's your obligation to represent everyone, so you have to vote, yes or no. But the yellow is there for an excused vote if you have a usually financial conflict with something. As an example, we had a lawmaker from the Western Slope who ran a vineyard and had a winery. Well, if there was anything on the floor that talked about an increase in wine regulation or taxes on wine or anything of that nature, he would go down to the podium like this, and he would ask permission. You have to ask permission. You can't just abstain. You have to ask permission according to the rules and say, I have a financial interest in this, so I should recuse myself. I'm going to abstain on this vote. And he gets permission from the body. The body can refuse if someone. So it's not like, oh, I really don't want to be on record voting against this, so I don't want to vote on this one. No. You have to vote on it. And so if it passes third reading, now it goes over to the Senate. And because we had such a great time on the House doing all this stuff, we get to do it all over again. Wow, cool. So we do that whole thing all over again. Now, after it passes, let's say it gets down to third reading and it passes, and this will happen with the Psychiatric Advanced Directives Bill as an example. The House passed it unanimously, got to the Senate, it was heard in committee last week. There were 4 amendments that were put on it, which we were fine with. The Senate's going to be voting this week. Because the Senate version is different than what was passed in the House, it has to go back to the House for a revote. It's because the House didn't vote on that version, right? And this can work both ways. If it starts in the Senate and it gets to the House changes it, goes back to the Senate has to revote because it's now a different bill. And so if a legislator who is carrying the bill has some options. They can say, okay, House members in this case, the Psychiatric Advanced Directive Bill got 4 amendments on it on the Senate side. We're fine with those amendments. We think it makes the bill even better, and so we're happy to accept those, so please vote for it, and you're done. If you go to the microphone, and I have had this happen, where you say, legislators on the House, we had a great bill, and we took it over to the Senate, and they messed up. They put stuff on it that I don't want, that I didn't like, so I would like to have a conference committee. And that's the next step here. So it can go to conference committee. So leadership appoints 3 members of the House, 3 members of the Senate. They get into a room. Sunshine law means that that room has to be open to everybody, so anyone can come in and listen to that debate. And then the 6 of them go at it about, well, what do you take it? Well, I don't know. What about that? Well, what were you thinking? Well, we were thinking this. And so all that gets debated, gets massaged. If the conference committee agrees, then the bill goes back to both chambers. So the House votes on the conference committee report, the Senate votes on the conference committee report, and says, yes, we accept it, yes, we accept it, and then they both vote again, third reading on the bill. A little complicated, but that's the sausage. So then the bill is ready to go to the governor. It can happen that a conference committee, they don't agree. This isn't often, but it does happen. You can dissolve the conference committee and appoint a second one and try again. Sometimes bills just languish and die there. By the way, there are 14 different times, because I've counted them, where a bill through this entire process can die. Why do you think there are 14 built-in possibilities for a bill to die through the process?
When you get the best bill you can.
Yes, so she said to get the best bill you can. Yes, it's to slow down things so that the general public has more opportunity to participate. It's to make sure that we're not rushing through ill-thought or not thought through legislation. Be deliberative, be thoughtful about it. So those are all the hurdles that you have to pass to get all the way to the governor, and you're not done yet. So it goes then to the governor. The governor has 3 options. You know about this one, of course. He can veto the bill. Nope, I don't like it. Bad bill. I'm going to veto it. In that case, the bill goes back to the House and the Senate, and the House and the Senate, with a 2/3 majority, can override the governor's veto. I can tell you in 16 years of being at the state capitol as an elected official, and more years than about another 10 years of watching the state legislature and being active there, I have never seen an override of a veto. The majority party is very reluctant to override their particular governor, whichever party is in power at the time. So I've never seen it happen. But it is the process, and it is possible. The other thing is that he signs it. And so then when he signs it, it becomes law based on what you have in the bill. Some become law immediately, some after a couple of months. Notice my optimism, when the Psychiatric Advance Directive bill passes, we're going to ask for a signing ceremony. And that allows a lot of people who worked on the bill to come and get your picture taken with the governor, and he'll sign it with multiple pens, and then once the pen's out, it's really cool. Anyway, that'll take place. Or he has a third option that no one really knows about. And the third option is he can let it become law without his signature. So the best example I can give you is, actually Hickenlooper did this once, and Governor Owens did this once. Only 2 times I've seen it. In Governor Owens, Bill Owens' case, he ran as a law and order, tough on crime kind of governor. And the Senate at the time, Senator Ken Gordon, late Senator Ken Gordon, actually championed this effort. He wanted to take people who were in prison for substance use disorders and reduce their sentencing by whatever, it was 3 years or 5 years or something. So if it was 10 years sentence, reduce it down to 7 years. Take those 3 years of savings from not having someone in the prison system, because that's an expense, and put that money into drug treatment. Great idea, and actually we did do that. We reduced some of those sentences and put the money into treatment. He had gone to the governor and he had gotten agreement. The governor said, well, yeah, you're right, it's probably a good thing to do, but it's, I ran on a tough law and order kind of platform, so I really don't think I want my name on it, but I will promise you that if you get it through the legislative body and you get it to my desk, I'll let it become law without my signature. And that is exactly what happened, and he was true to his word about that. So it became law without his signature. So that's a third option that the governor has. So in a nutshell, this is the entire system that we have inherited from our forefathers to have in our state to craft legislation and to enable policy to move forward. Your role, my role, your role, is to advocate at every step of the way. So you can influence a legislator everywhere in this process. It doesn't have to be committee, although that's your strongest because you can testify there. But you can send a letter, you can send an email, you can give a phone call to the office, you can walk in, you don't have to have an appointment really, you can walk down to the Capitol and see their aides. I would advise you to make an appointment if you really want to see the legislator, of course. But generally, if you want to see their staff and say, please vote for this bill, they do keep track of that, they do take it down, phone calls, emails, all the rest. And they keep that together so they know that this particular issue has a great deal of support. And that really helps. And by the way, it really helps, having been on the receiving end of opposition, it really helps to call your champions too, like Representative Landgraf and some others who are champions, and they're with us. They're with us in spirit, they got it. and you think, oh good, they're with us, I don't have to call them. But it helps to call them because it gives them moral support. Because sometimes if you're getting beat up by the opposition will come out stronger usually. It's like, I don't like that. And then you get the call saying, thank you so much for what you're doing, we really appreciate it. That's always appreciated by a legislator. So from personal experience, that means a lot. So your role is not just today, but today you can make a great impact. It's all through the legislative process. Follow bills, watch bills, call your legislator, visit with them. If they have town halls, by the way, go to the town halls. They're usually on a Saturday or sometimes on an evening. They're usually in a library or rec center in your neighborhood or something like that. And make sure that mental health is still a topic that always comes up, so you're educating everybody else who's in the town hall as well as your elected official. So that's how you can make, and you do, make great inroads. Most bills that pass are because someone took the time to tell a legislator, we really need to do something about this, whatever that might be. So that's your role. Any other questions? Yes, ma'am.
Is there a length of time between when a bill goes to the governor and he or she decides not to sign it? Is there a period of time?
Yes, there is. That's a good question. So is there a length of time that the governor has to sign a bill? Yes, there is. There's actually two limits. The first is 10 days within the legislative session. So if he gets a bill in March and he's going to veto it, he has to do it in 10 days. That's in order for the bill to be able to go back to the Senate and the House for an override. So that's part. Out of session, the governor has 30 days because there is no override potential once it's out of the legislature. Also, the bills really pile up by the time, there's about 650 bills that are introduced every year. Isn't that amazing? and you're trying as a legislator to keep up with that. But 650, and so you have to figure about a third to a half are going to get passed and get to the governor. So let's say he's got to read 250 to 300, and his staff helps him with that, and he'll go through that, and so he has 30 days after.
And if they don't sign it,
It becomes law automatically.
after that 30 days?
Correct. If the governor chooses not to sign it, it becomes law after that 30 days.
And after 10 days during session?
Boy, I'm not positive about that. I think it becomes, I'm looking at Senator Newell. Lifeline, I think it becomes law upon enactment of the bill. So some bills will say, this law takes effect on July 1st because that's the fiscal year. Some bills will say this bill becomes effective 4 months after. So that's when it's actually going to become or become a law. Yeah.
Mo, when you were a senator, if there was a bill that was, say, a mental health bill, it was not like a statewide income tax increase that everybody was, aware of. Bills like this, the number of constituents that would call you or write you or testify, what do those numbers look like, just so we have a feel for?
Well, did you hear the question? Yes. How many individuals actually call a legislator on any given bill, depending upon whether it's high profile or low profile. High profile, 800,000. I mean, if you get into some of the hot topics, things like guns or things like sexual education or things like, those are real hot topic issues. You'll get hundreds on one side and hundreds on the other. What I used to do, because this was years ago in 2010, it's probably harder today, is because I didn't have social media at that time, is I would have a staff member help me sort them out. So as we got them, all the opponents did a file folder, and all the proponents, we did a file folder, and that way I could at least prepare a response based on their position. So that's how I tried to do that. But in terms of something like psychiatric advance directives, which is a much narrower public interest, although we have 34 organizations represented, I get, I don't think I'd get 10. I'd probably get about 10. And that would be because organizations like ours at Mental Health Colorado are sending out to our volunteers saying, make sure you call, make sure you email, because this is really important. And so X percentage of our volunteers will follow up and do that phone call or that email. So if you don't have an organization that's actually pushing for that particular issue, you probably won't get very many. And there's a lot that we don't get any. Yeah.
How does it get decided which committee a bill goes before? I mean, sometimes they go to the, mental health bill goes to the Veterans Affairs Committee, which is the Hill Committee. How does it get decided that something goes to a certain one?
So her question was, who decides where a bill is assigned to what committee? And she referenced something called the State Military and Veterans Affairs Committee, which is endearingly referred to as the KILL Committee, because that particular committee is where the leadership, so in the Senate it's the Senate President, in the House it's the Speaker of the House, they will decide, although not always alone, sometimes with their political party's leadership, they will decide where to assign a bill. If they don't want a bill to get to the floor so that every one of their members is on record as voting for it, they're going to protect their members because it's going to be used against them in the next election. They will often send that particular hot topic to the Senate or House State Affairs Committee, and that it will die there. It will deliberately be killed there. That's how the two parties protect their members from the next election's negative mailings and negative campaigns. Sometimes the bill is sent there because ideologically the party in power doesn't agree with it, and that happens too. So if it's a bill that either the Republicans or the Democrats don't like, they will also send it to that committee on ideological reasons. We're not this. Generally, the Speaker of the House and the Senate President try to send bills to the committees that most match it up. And so mental health could go quite in a number of places and has. It's been in Judiciary Committee, it's been in Education Committee if we're talking about schools, it's in Criminal Justice if we're talking about prisons, in jails. It can actually wind up in quite a few committees. And as a sponsor, you can ask for where your committee can go. So I used to go to both the minority and the majority leaders and ask, can I please have my bill go to this committee because it's friendlier? And if you sometimes get that and you sometimes don't, depending on the bill. But that's how it's designed. Did you have a question too? Okay. Any other questions? Super. Oh, way back.
Well, I've heard that it really takes about 7 years and 7 times to go through before you really get things passed. Is that how history kind of changed, or is that still true?
That, you heard a question, it takes about 7 years to get a bill passed. No, I wouldn't say 7. We have a joke about 3 years. So many bills pass the very first time they come in. But if it's a bill that's complex, or it's a new idea, such as Representative Landgraf, she's going to do a whole new assisted living certification through licensure, through the Department of Public Health and Environment, and she has their cooperation and support, by the way, thank you, Public Health and Environment, CDPHE. They've got an agreement, so it'll probably pass this first year. I think she said she had an assurance, which I had not heard before, so that's great. But if it's a brand new idea, you got to bring the legislators on board. And if they've never heard it before, they're somewhat reluctant that first year, and they tend to kill it. And then you bring it back a second year, and they're a little more, now they know the issue a little better, but they're still not on board. Third year is, it's old news, so it's not new anymore. They're used to it, they've got accustomed to it, and it has much more potential to pass. So I'd say 3 years for something that was really different, something that was really new, but for, or didn't have as much opposition. The opposition starts to get engaged, and then they change their mind, and then they have more amendments, and then they're not opposed anymore. That can take 3 years. But generally speaking, a lot of bills come in and can get past that first or second year. you all very much. Thank you for being here. Thank you for being advocates, and there's more to come.
Thank you all. So, in the spirit of keeping things moving, because we're on a tight time frame today, next up is our panel. So I was going to ask our presenters to come up, and they already are here, so yay. And Mo is part of the panel, but she's also going to be doing some of the introductions of the panel member from over here. And I think we need to turn the mics on. Awesome. And just a friendly reminder, when we're done here, we're going to be asking all of you to quickly get your bags and extra food that you want, and we're going to head over to the Capitol steps, on the west steps. We're going to tell you this again when we wrap up. We just want to make sure that you know. So even though it's not an official break time right now, it's a good time to find the men's or the ladies' room and take some phone calls, etc. So, great. Thanks. Oh, are we ready?
Yeah, I'm ready. Thank you. So it's my pleasure to introduce our panel here this afternoon, this morning, still morning, this morning. The first is Chelsea Dumont. She's from Washington, D.C., arrived yesterday or the week before? Sunday. Oh, even better. Even better. Welcome to Colorado. Chelsea is the manager of public policy events and programs for the American Foundation for Suicide Prevention National in Washington, D.C. She works with AFSP chapters in all of the 50 states, and it's her mission to bring suicide prevention to every state capital in the country. Prior to her work with AFSP, she worked for government relations for the Blinded Veterans Association. So Susan Marine is very active in suicide prevention issues. She won the Sandy Martin Grassroots Award Field Associates of the Year at the National AFSP organization. Susan has played a major role in mental health and suicide prevention legislation in Colorado by forming partnerships with bill sponsors, organizing stakeholder meetings, and arranging for testimony in committee hearings. She was chair, are you still chair? No, she would not. She's as chair of the advisory committee for the Suicide Prevention Coalition of Colorado. Susan has been remarkably effective, helping to pass House Bill 140, and that was in 2012, which directed the Office of Suicide Prevention to work with hospitals to provide information on those trained for suicide behavior and their families, as well as Senate Bill 1288, and that was in 2014, which created the Suicide Prevention Commission of Colorado. She worked closely on the development of state laws on suicide prevention, training for school personnel. She has been an essential leader in bringing about statewide change and continues to be a local champion for suicide prevention awareness and education. And she does have experience with suicide in her family. And it's my pleasure to introduce Senator Linda Newell. We actually served, we overlapped, our terms overlapped, and we served together. She also won the Allies in Action Award from the American Foundation for Suicide Prevention. Was that 2 years ago? Last year, okay. Through her work as state legislator, Senator Linda Newell has significantly raised awareness of suicide as a public health problem in Colorado and successfully introduced multiple bills aimed at helping it's very dark up here. I'm so trying to do this. helping to expand suicide prevention efforts and resources for Colorado residents. Under her direction, key legislation, including the Colorado Suicide Prevention Plan and the Zero Suicide Model that created the Suicide Prevention Commission, and the Suicide Prevention Act, which helped to provide resources for families of attempted survivors. Does that make sense? Have been enacted nationwide and statewide. And I would say that Senator Newell actually was the first, oh, thank you, now they turn the lights on. Thank you. She was very persistent, along with Susan Marine, very persistent in getting the Zero Suicide Model passed in our state legislature 2 years ago, I believe, or 2016, right? And it was a marathon effort because she had a great amount of resistance from some fellow legislators. She worked very hard to get that passed, and so much so that at the end of it all, she created a video called The Last Bill. It was her last bill in the Senate that she carried, and in her career as an elected official. And she outlines that whole, through that 10 minutes, the months and months, and maybe even more like years, that she tried to get this passed and finally did get it passed. And because of her actions today, we have a zero suicide model in our state law. We didn't fund it, but we have it. So I think she deserves a round of applause for getting this passed. So we have 3 asks. If you go through your, I'm sorry, too much talking around. If you go into your packets, you will find a form that says our asks, our behavioral health, behavioral asks. It should be on the right side, and it should be visible. It's an 8 by, yeah, there you go. And that's it, right here. And so we have 3 asks of you today. To talk to legislators about. The first is Senate Bill 10, and that is Mental Health Colorado bill I'll talk about. Then we have House Bill 1129, that is prohibit conversion therapy, and we have someone else speaking on that. You're speaking on that? Susan is speaking on that. And then we have the funding request for Zero Suicide Model statewide, which is not a bill, but it's a funding request to get into the budget. So I'll talk about that in a little bit. Has everyone found that sheet? Okay, very good. Was that a no? Or was it yes? Okay, very good. So the School Behavioral Health Services bill, right now the Colorado Department of Education has 2 grants that they allow for school districts to apply for. One of them requires a match, the other one does not. And it is specifically for emotional and mental wellness. And that's been underway for a while, and there are schools that take advantage of that. But what this, what Senate Bill 10 says is it expands it to include training for individuals who are working with youth to spot suicide ideation, to work a little bit with youth, to respond to bullying efforts, and so it opens up that grant to expand for a broader efforts at prevention and training for individuals. That's one of its biggest purposes. So we have done a lot of work on schools and mental health because we believe that we have a saying that at our national model, before stage 4, and you can hashtag it, it's the letter B, the number 4 stage, and the number 4. Before stage 4, because mental health and substance use are the only physical conditions where we actually wait until stage 4 crisis before we go, oh, I think we better pay attention to this, and start investing some money. If you had cancer or you had a spot on your hand and you went to the doctor and said, could it be cancer? They wouldn't say, well, could be, but go home and when it's stage 4, come back, and then we'll take a look at it. We wouldn't, as a country, tolerate that, and yet we do for mental health. This is a great before stage 4 effort in Senate Bill 10. So this is the first ask that we have for you.
The second ask on your speak out sheet is the House Bill 191129, prohibiting conversion therapy. This bill would prevent licensed psychiatrists and mental health providers from engaging in conversion therapy. Conversion therapy is based on the belief that homosexuality is a mental illness. We know it is not a mental illness, that indeed there is a continuum of sexuality. This is the 5th year that such a bill has been introduced, and we are hopeful that this will be the year that it passes. 15 other states have passed such legislation. It was introduced and passed through the House and introduced in the Senate, but unfortunately it's been assigned to the Senate State Veterans and Military Affairs Committee. And that is the Kill Committee. I have no idea why this was done. But if your voice is needed on anything today when you're at the Capitol, please go to your own senator's office and ask them to vote in support of this bill. In addition, on the pink folder that you have in your pamphlet, there is a list of senators and which senators are on this committee. And I very much urge you to contact those people on that committee, either go to their office in person, or call, or send them an email, because that's really a place where we need your input.
The third ask that we have of you today is for asking your legislators to support funding of $861,000, I think it is, for implementing the zero suicide model in our state. As I say, we have it on law, but we never funded it. That was one of the sausage making that came through in 2016. So your flyer here says at the very bottom, will be in the long bill. Actually, we have no guarantee that it will be in the long bill. That's your job right now today to convince legislators to get that money into the long bill. So
the long bill is
sorry.
the state budget for next year.
We call it long because it really is. It's about this thick. And so we are hoping to have this amount of money, and it's a big ask because, as I mentioned before, we're competing with a lot of other interests. But we're asking for this $861,000 to be supported by the legislators to get into the budget bill. And the Joint Budget Committee, which is responsible for writing the budget, consists of 3 senators and 3 House members. The best thing to do is to get it in with their effort as they craft the budget bill. But the budget will come over in March to the Senate and the House side, it'll be late March, I believe. And any legislator can add this amendment if it's not in there already. So every legislator has a role to play in doing this effort. So please ask for that funding. Tell them that, you know, we're all working, all of our organizations are working on getting this funding into the budget, and we've been in contact with the Joint Budget Committee. That work has already been done in case they ask you about that.
Do we have any questions on those 3 bills? You guys are easy. Yes?
So the conversion therapy bill, conversion therapy, it's going to the Bill Committee, but it's primarily Democrat, right? So that's likely to pass.
The question was, if it's going to the Kill Committee and but it's in a Democratic Senate, then it's likely to pass. That was the question. I did want to say that sometimes that is not the kill committee. It is often the kill committee, but there are times when it goes there because it is actually a state affair or an election law or something like that. But other times it goes there when other committees are really full on their bill load. Or to Senator Keller's point earlier, sometimes certain people on a particular committee don't want to be shown on a voting committee and are maybe still thinking about it, and they've asked the president, can you not bring it to my committee? So it could be there for some of those other reasons, and I have every intention of asking President Garcia why it's there.
But your voice is very much needed.
Yes, in the back?
You know, before the next question, another thing you can do is go to the leadership and ask them, why did you send this bill there? You know, don't let anybody look at that necessarily. You know, call them out. And what the heck? Why did you send this bill there? It doesn't have anything to do with state affairs or military members, right? So you can do that, and probably should.
I believe there was a question in the back.
Yeah, it's not something that I'm proud of, but not something I'm ashamed of. But I wanted to speak up for the people like myself who have attempted. Some of us were kind of looking for more details, things that might give us encouragement. But I feel like reviewing the goals and some of the bills, it's very, very vague at best. And I just wondered, you know, when do you guys get to that point after reading all the personal vignettes that cover more of the specifics of how we're going to be helped? Because a lot of us have already been in and out of the mental health system, and we understand how the pharmaceutical industry works with us, but it still doesn't give us a great deal of hope. I was hoping at some point in the process today we're going to go into more detail.
I will speak from my experience as a suicide survivor, loss survivor. I lost both my son and my daughter to suicide. And it took me a while to figure out how I was going to use my voice. And for me, it has become advocacy. And I have testified often over the last several years, and very often citing my own personal story. And I can tell you that sharing your personal story is extremely effective. And people sit up and listen. And oftentimes it leads to the legislators in the room sharing their own personal stories about having been suicidal themselves or having lost someone in their family or a good friend to suicide. So it is something that we haven't woven into our program this morning, but I can tell you it's very much needed, and that's what I have done over the years. And I've also worked on designing pieces of legislation that address problems that I know exist. For instance, the first bill back in 2012 addressed hospitals, emergency rooms, improved the information that they were expected to share with patients who had been suicidal that come into the emergency room or come into the hospital. Because my son had been in the hospital, a psych unit, for 2 or 3 days and was discharged, and nobody told us that the first day or so after discharge is an extremely high-risk period. And my son died of suicide a day after getting out of the hospital.
And if I just may add to that, a legislator in their office, they don't know what they don't know. So if they've never encountered suicide or somebody with self-harm ideation, they're not familiar with the situation like you and I may be. And so this opportunity today is really an opportunity for you to use your voice, inform the legislator of areas that they can take action in the future, tomorrow, write a bill, and use you as a resource in that area, and really become, use you as the expert, because they're not aware of things.
That's especially important because our legislators do not have any paid staff except for during the session, which is 120 days. And they, you've already heard that they consider maybe 600 bills. They cannot possibly have knowledge and understanding in all of those areas. So people who work as grassroots advocates can play a role as working almost as a staff member, compiling fact sheets, organizing testimony, and so forth.
I'll add to that. First, I want to acknowledge you, and thank you for being here, and thank you for standing up. And I see you, and I know that this vehicle today may not be the best vehicle for you for support, but you do have a community here that you can rely on. The SPCC, Mental Health Colorado, AFSB, I cannot say enough about the community here. And I did not know, even though I'm a daughter of a psychologist and I heard all about suicide from a clinical perspective at home growing up, I did not know the ins and outs of what to look for as a legislator, as a community member, as a parent, until I got with these communities. And I do want to say, though, that literally changed my, not only legislative trajectory, but my life. I am now a volunteer chaplain at a hospital and have gone in, I'm getting a master's in seminary, at ILIF Seminary, and in social justice and ethics. But part of that work is doing chaplaincy and pastoral care, and walking into those rooms with those who have attempted suicide after doing the legislation with Dr. Marine on how to deal with people leaving the hospital environment when they are at such a high risk. It just has really radically changed my life. So in that, I have been able to make a difference in other people's lives. So just by you being here and talking to one other person after today, you will have started to make a difference. So I wanted to say a couple of things while I have the mic about grassroots. This woman is my hero. She wrote in the legislature. I had the blessing of having Senator Keller as my mentor in mental health, particularly in budgets and mental health and the system of mental health. And then I was able to grab a hold of Susan Marine after we worked together the first time, and together, and I say this together, even though my name is on the bill, and sure my name says it after Senate Bill 88, 147, but this woman is the reason why those bills got passed. So the grassroots role is extremely important, and especially at the state level, because we don't, and especially in Colorado, we don't have paid legislative staff. So what we have done together over the years working together is we have gone in from different roles. So I will go be talking with legislators on making sure their votes are in the right place for her bill. She will be going to legislators that I can't get a hold of because we have so many to get a hold of in all in one session. So we'll tag team it. We help each other when we're writing the fact sheet about a bill and how does this impact. We we work together on a testimony. And what is our testimony lineup going to be? What does that look like? One of the bills that we didn't do together, but I did a cyberbullying bill one year, and it was assigned to the business committee. We were in a minority at the time, and by the way, majority matters. So to know which party is in charge, that matters, and so you need to make sure to hold those leaderships accountable, whomever is in charge at the time. But anyway, at that time, the chair of the committee was going to vote no on the cyberbullying bill, and one of the big pushes for the bill was suicide prevention. As you well know, if you deal with youth, is the suicidal ideation after social media presses against a soul. And so I ended up finding a mother and a quadriplegic. She had very limited brain functioning after a suicide attempt, and her father found her. And I found them in the chair's district. And so I brought them in, and she and I had been talking months prior, and it turned out that with her testimony and her daughter by her side in a wheelchair, the chair voted for it and it passed out of committee. And we ended up, even though amending that bill, we ended up passing that bill. So the power of getting those people to come and testify, and I'm looking at you because you're the ones with the stories that we need to hear. And so if you do get nervous, many of us will help you in mentoring you in how to write it, mentoring you in how to deliver it, or if you don't feel like you can share it verbally, you can also write it and submit it to the chair of the committee. And a copy of that will get to every committee member. So you can do it that way as well. And you can also help if you feel strong enough and you're in a good place to do this. You can also help count votes with whomever the grassroots person is. Usually it's been Susan Reed, but you can help in many different ways. If you do end up emailing, I did want to say this because Senator Keller mentioned it, a great tip is in the subject line. You want to put the bill number, if it's an SB, Senate bill, HB, House bill, the number, and in the very top, somewhere saying, I am your constituent. That's really important to get through to your legislators. And don't forget both houses, the Senate and the House rep. The other thing I wanted to mention was, Senator Keller mentioned the budget. So I forget what year it was, but one of the years that I could not get money into one of my bills, I ended up getting an amendment on the budget for $100,000 for the Office of Suicide Prevention. And amendments don't always get through, but that one did because I went to every single freaking legislator on that chamber floor that day, and I said, you've got to help us get this through. Well, when you're talking about billions of dollars in a budget, $100K is nothing. And it really isn't. However, to that dinky office, which is still a dinky office, 100K meant a lot at that time. And so other people who are working on the budget amendment to get the dollars for the zero suicide. The reason why we didn't have money in the zero suicide bill at that time was we were lucky to even get that bill through at all without any money to it. So sometimes you get a bill through and then the following following year or two, you put money to it. So that can happen too. So I wanted to say just those a couple things. And then lastly, we did create a documentary based on the Suicide Prevention Bill of 2016 on Senate Bill 447. So there is a documentary. It's 26 minutes and 40 seconds. And that's so that we can eventually get it onto PBS. But our goal is to, it teaches the legislative process using the Zero Suicide Bill. And so both Susan and I are the kind of the stars, I guess. But if you are interested in that, we can come out and speak to your own community and to teach people the legislative process and use the film. And then the goal is to get it in every library, in every school across the state. So if you feel, or if you're in the position to be able to donate to that, either time or money, that would be phenomenal too. So I just want to also lastly say, and I know I've been having Mike for a second, thank you. Thank you, because I, as a suicide loss survivor myself, thank you for being here and making your voice heard. We need that, or not we, the legislators, it's no longer we, the legislators need to hear you.
I might just close this particular question by saying that anyone, yourself or others, who are interested in getting into more specifics about any mental health issue, I'd be happy to visit with you later or set up an appointment. You can come to our office. We get into a lot of detail on a lot of things, and so I'm happy to offer that service to anyone who might be interested.
I have a quick question. I wrote a thing about why it's important to me and what can be done, and it was kind of like a little letter. Can I put that as part of the elevator or not?
Yes, absolutely.
Thank you.
And just one quick thing, just about the training portion of training mental health workers in the school systems. I think that is such an important thing to have facilitated. I'm just curious, the gentleman who brought up like going through the system and hospitalizations and pharmaceuticals and things of that nature. If we're open, if the funding did come through, if we would be open to different training ideas, maybe that are outside a little bit, not like making medication and pharmaceuticals a piece of the pie, but not the whole pie, and being able to put some of the funding toward training toward the whole pie, so that a person would have a better chance at seeing some optimism, some hope for the future. So like nutrition and many other avenues, knowing how to express one's emotions. For instance, sadness is one thing. Anger is another thing. People get angry, and inside of themselves they suppress this, and it builds up, and they're in pain, and they're hurt. But if God forbid somebody get angry, boy, oh, that's not acceptable in our society. We need to find ways that people can vent their anger, punch the punching bag, scream in your pillow, scream, a place you can scream it out and say, I'm angry, why? And get some of this stuff inside of us out. And I think with the kids, the adults, so many of us are in such dire need of that type of support. And if they're open to that type of training with the budget money, I think it would at least give some assistance going into it.
Yep, absolutely. The bills that we've given you today and those three asks are really just a starting point. As you've identified, there are several other areas that we can invoke training. We can train our students, we can train our teachers, we can train our bus drivers, we can train our bosses at our jobs every single day to identify suicidal ideation not only in others but in ourselves, and really identify the resources and the outlets that we have available, because again, we don't know what we don't know. So if there are resources within your community, share those with everyone that you're aware of, share the crisis line, and really be vocal about this cause, because suicide, as we know, is a cause that is not talked about. It has this stigma surrounding it, and nobody wants to start that conversation. So that's why we're all here today. If you have ideas of where we can invoke suicide prevention training and other resources, resources, please share those with the folks around you, share them with the local organizations, and share them with the legislators as well so they can become informed.
One more thing, is there a way, because it's so powerful to have a room of so many like-minded people together, and I'm really just new to this. I came about finding out about this in a very unique way. And so, is there a way that we can all somehow get onto an email list or some way that we can have the people in the room all together?
Yeah, we can certainly try and facilitate that on the back end, absolutely.
If everyone's willing to have your email shared. Well, that's
Whoever's willing, right?
I mean, we do want to respect your privacy, so with what, was your name Rose?
Oh, I'm sorry.
Yes.
That's my grandmother's name.
Oh, it was close.
Jennifer.
Jennifer. So what she was suggesting is that because of these real strength of all of you being here together on a common mission and a common purpose, perhaps trying to share email on an email list for further information, webinars. Mental Health Colorado does quite a few webinars for our volunteer group, of which Jennifer is a member. But supports, resources, that kind of thing, maybe sharing back and forth. What Chelsea was saying is that yes, we can do that with all your emails, but we do need to know that all of you are comfortable sharing your email because not everybody wants to do that. So I'm going to
Just create a point person and say yes or no.
I would recommend that, how do you want to do that?
I think we'll coordinate that on the back end and send an email out to everybody, and if you want to be connected after that, just let us know.
In addition, SPCC will be sending out action alerts, giving you the status of these asks as they move through the legislative process and suggesting you what you might do to advocate on these issues.
Yes. Oh, sorry.
I was going to say there is one other opportunity for even testimony that you can show your face and start to talk with legislators, and that is to attend the behavioral health caucuses and go, and that is, when I was there as co-chair of the behavioral health caucus and the children's caucus, and it really helped to get people in the room when we were hearing different issues that come up. Sometimes they're around bills, sometimes they're not, but they're around an issue that the legislators need to understand. And so having you all there would be very good for that too. Can they find out through mental health?
Sure. It just so happens that our first behavioral health caucus will be this coming, it's tomorrow. I was going to say this coming Wednesday. That's tomorrow. So it's tomorrow from noon till 1 at the state capitol. We'll be in room 354. And that is where we provide lunches for legislators. Lunch is not available for the general public. But the topic tomorrow is going to be children's access to care for children's mental health as told by parents and their perspectives and what they have to go through to be able to access care. And then also the Rocky Mountain Crisis Hotline, which is the 24/7, you're all familiar with that, I think. The hotline, they opened up about 2 months ago, I think, texting. So they were only doing phone calls, now they're doing texting, and they're overwhelmed. You can imagine, they are overwhelmed, and it's mostly teenagers who are contacting them, texting, asking for help in some way. They're going to be talking about what they're doing for youth with regard to texting now. So those are going to be the two topics tomorrow, 12 to 1, here at the state capitol on the 3rd floor. And they're open to the public, so you're welcome to attend that. And then we will have one in March and one in April. So different topics, but let me know if you're interested in that, and I'll get that information out to you.
Hi, so my name is Chris Bates. I'm with the State Office of Behavioral Health. And I also want to highlight a lot of the legislation, it has current legislation that is being pushed forward. Always look out for opportunities to be a part of the boards. Almost always there's a requirement, especially for mental health, that we're asking people to put on there somebody with lived experience or families. So if you all look on the governor's boards and commissions page, like the Office of Behavioral Health, we run a board on mental health holds.
Prevention Commission to both Sue and I serve on that, and that's a great point, really. Yes?
If you can't come into all these meetings, I live up in Leadville, you can't always get down that way. Can you send information that you want to go, like the council that's happening tomorrow?
The Behavioral Health Caucus, we don't have minutes, it's a conversation. However, your point, if you wanted to be on a board or a commission, very often they want to have the rural perspective. So they're actually looking for that. So for boards and commissions, you have a call-in option. So you could be a legitimate member of the board and have a call-in option every month or every time they meet and be part of the conversation. They do take minutes, they will send those out to you.
And it is often possible to have remote testimony within the committee.
Right.
These have been great questions.
Yes.
So, I'm sure you have heard of Project Semicolon. I've read a lot of those children's stories, and they hit me really hard, having experience with mental health from age 7 to now I'm age 48. What about those of us who have a broader story to tell, and we don't want to write it down and submit it and feel like a number? Who would I talk to be more proactive?
Good question. If you are interested in your story to make a change, where, in other words, between the ages of 7 and 48, where was there no help for you? Where did our policy throughout our state fail? Was it you couldn't get it? I mean, whatever it might be, and I'm not going to press you on that, but whatever it might be through that stage, a legislator is a good way to start because they can say, what do you mean? No, I didn't know we didn't do that. So, and you start to make change that way. But if you're looking for a story that you want to share with other people who have been in the same situation, and maybe the ultimate outcome would be change as well, but more for that support and that resource, that would be different, and we could probably I can probably give you some situations on where you could go to talk to people in that regard. So if you're thinking about change, you want to use your life experience to say, I don't want this to happen to anybody else, and I want to have an impact, and I want to make a change. A legislator is a good place to go. But you can talk to me too, because we do a lot of legislation. Even our organization, Mental Health Colorado, has 7 bills in this session. And the Psychiatric Advance Directive bill came to me from someone we knew personally who had bad experience because he didn't have an agent. He didn't have information written down that was respected by that emergency room, and a lot of things happened that were counterproductive. So it does make a difference. So I'd be happy to meet with you and see if that's where you're headed, if that's what you would like to do, because we do make change. We do make positive change. We do. It's kind of like 3 steps up, 1 back, 3 steps up, 1 back, because you have defeats. But we do make change, and I can tell you from when I was first elected in 1992 to today. In 1992, 2 things happened. One is legislators didn't have any idea what I was talking about when I talked about mental health. They thought I was talking about developmental disabilities. We have schools for those kids. Why is that? That was and then the second piece is that the shame. I had legislators come to me and say, I have a family member who's in a residential facility right now, but if you tell anybody, I will deny it with everything I have. The shame was incredible. Today, we've come a long way from then in both those regards. Legislators are educated, they get it, they're open about their own family situation, and they're eager to be involved and to make change. We have great administration and legislature this year to make change. So it's very positive, so it's exciting. So, now's the time to really push for that. Yeah.
So I think for me, the first time I was admitted was for 6 straight months in Children's Hospital at the age of 7. And there was a lot of talk therapy, but during that time frame, there weren't a lot of these organizations that exist now to help people with mental health issues, and a lot of the disorders that I was diagnosed with, those titles didn't exist. As I got older, after leaving the Army, on the discharge, I found February 2012, when I attempted to take my life, I tried to overdose on lithium, which is a heavy antipsychotic. I was hoping that I might destroy my liver and my kidney in the process, and that was going to be the thing that freed me from all this depression. But what was so disturbing was after I was admitted into Florida Hospital, they made it very clear that they wanted to keep me there for the least amount of time possible and get me right back out in the system that I felt was broken. So when I left Porter Hospital that day after being there for 5 days, they gave me all the same medications I tried to kill myself on. They gave them back to me and sent me back to my psychologist, who was unwilling to bend on putting me on anything else that was causing hallucinations, causing more depression, vivid nightmares. I think my suicidal ideations, I think they were elevated after I left the hospital. This is a huge concern for me with children and young adults.
Yes, it is, and you're 100% right about hospitals wanting to discharge as fast as they can. It is indeed. Mental health is not a moneymaker. It's just how it is, and that's one of the things we have to fight. So let's talk afterwards. I'd like to sit down and visit with you, and so we can move in that direction, because we are doing certain things on hospitals right now in this legislative session that might be helpful. So you might be able to help us with that.
So my concern is that I'm a former bilingual ESL teacher from 4 different states. Every time I personally resigned, that it would be Common Core, and how he's stabbing the back of ESL students is putting more arrows in them and oppressing them. The lack of support from the administration and all those districts was not supportive either, nor, I feel like I was hitting my head against the wall for 17 years. Now I'm a life coach. I help myself lose 100 pounds because I was an emotional eater from all the stress from being a teacher. So I guess it's not just adult, it's the whole community. Like,
yes, it is.
What is going to be done at all these different levels for age-appropriate levels where we're not forcing it on them, it's nothing, but we want them to participate, so that way awareness grows for mindfulness practices.
And what she was talking about is how the system is fragmented and broken, and how, especially with children, we don't do enough resources, etc. We're well aware of that, and two things I'd like to say. The first is that we have a new governor, right? He has 4 years, potentially 8 years, to redesign the whole thing, and we have asked him to do that. Mental Health Colorado has already met with him a couple of times, and the Lieutenant Governor, and the Attorney General, who's working on mental health access to care as well, who's been very receptive. This is a good time for us to try to do that redesign, because while some people say the system is broken, I would say we don't have a system. It's that's over there, that's over there, that's over
Need
there.
a commissioner of mental health.
Yes.
Well, it could happen. It could happen. So now is actually a very exciting time to get engaged. And so, talk with me later about, how you might best want to do that. But we are actually constructing a kind of a continuum of care that we would like to see the state move towards. It's going to take a little time because it's moving the Titanic, and you got to move the ship. But it's also going to take a lot of money, and that's the second stage. But I always say, let's do the plan. Forget about the money. Don't let that hold you back. Let's do the plan. Let's come up and see what we need, and then we worry about funding it. So there are movements in that direction. It's kind of an exciting time right now because we do have this interest.
So we did get the note that was our last question, but just to wrap up our panel and reiterate, sharing your story is the most important piece. You're giving a face, you are giving a name, you're giving a story to a piece of legislation that might not be there today, but it might be there tomorrow or a year from now. And you are going to be the person that legislator thinks about when that piece of legislation is put in front of them. As you're going on your visits today and speaking with people, I do want you to be mindful of the language that you're using as you're sharing your story. First and foremost, make sure you are in a good personal spot to share your story. You are under no obligation to. If you are able to, please feel free to. I also want you to be mindful of the language that you use, as it may be triggering for other folks that are around you. So in speaking of methods that somebody may attempt suicide or complete suicide, please just think about that. And again, as we are trying to break the stigma, one of the big things that we are pushing is to take away that word commit. We want to say somebody completed suicide. We wanted to say somebody took their own life. but the word commit really adds to that stigma and makes it almost a criminal act. But I do want to thank you all on behalf of my organization, on behalf of the organizations that are here for the panel and hosting, and especially Johnson & Johnson. You all are the voice, you are the reason that we are here, you're the reason that I go to work every day, and I truly appreciate it from the bottom of my heart.
Thank you, Chelsea, Mo, Linda, Susan. What an amazing panel, and ladies rock. You know, I know there's gentlemen in the room too, but it takes a village, so thank you all again for being here. A couple of housekeeping things still. We need you over at the Capitol steps as soon as possible. It's almost 10:30 right now. The pictures will be taken at 10:45. Actually, have the governor coming to greet us. Before you leave, please get a green bag over there. And if you want, we're going to have some extras. You can have more than one. Grab some extra food. Grab some tchotchkes in the back. And see that door over there where Alexis is waving and it says exit? We're going to go out a different door than you came in. We're going to go to the alley and make our way over